This is Michael Smith of MedPage Today in Denver at the annual meeting of the American Association for Cancer Research. Chronic lymphocytic leukemia, or CLL, is the most common adult leukemia in the U.S. It's also a mystery. Little is known about the genes or environmental factors involved, and until recently, there were no warning signs of the illness that clinicians could search for. To try to find such clues, Dr. Neil Caporaso of the National Cancer Institute and colleagues turned to the landmark prostate, lung, colorectal, and ovarian cancer screening trial, which has been following about 77,000 people who were healthy when they enrolled in the trial in 1992.
So we went to that group and we were able to find 109 individuals who had information, had given consent to use their samples, and had available blood work.
In whole blood drawn at baseline from some of the PLCO participants who went on to develop CLL, the researchers found an abnormal clone of B cells, a finding they reported earlier this year. But they wanted to know more.
Given that people had this abnormal clone, the next step was we decided to look and see, well, could we find something in their serum? Could there be some other immune marker, protein marker, that might indicate the progression of the disease and what makes someone go from having a benign clone to the actual disease. So for the serum, because serum's a little bit easier than cells, we were actually able to go back 10 years and find blood collections before diagnosis.
The researchers didn't find low levels of gamma immunoglobulins, a hallmark of CLL, but they did find another indication of immune dysregulation, in some cases almost a decade before the disease itself was found.
The really surprising finding was that an abnormal free light chain ratio was observed in almost 40% of these subjects, and there were about a little over 106 subjects up to 10 years prior to diagnosis.
The test for free light chains is commonly used in multiple myeloma to monitor the course of the disease, but Dr. Caporaso doesn't see an immediate clinical application of the test in CLL.
It typically does not have a role in CLL, and we would not recommend it for screening at this time. The reason is that we really need further work to understand precisely what it's doing and what its behavior is. It would be nice for someone else to confirm it. We just need to understand it better. The second reason is that a screening test for CLL is not a high priority because right now we know of no early intervention that can really help with CLL.
In Denver, I'm Michael Smith, MedPage Today.